Our next speaker is Jane Reed. She's the Director of Community Services for Autumn Journey Hospice. She's going to talk to us today about myths and misconceptions about hospice. Please help me welcome Jane Reed.
How many people have had an experience with hospice? Any experience at all? How many have had a good experience with hospice? Works that way every time. Let's talk about what hospice is. Hospice is a program of care that it's physician-directed, nurse-coordinated. It's an interdisciplinary approach, which it means that we use the services of different medical disciplines to provide for the comfort of the patient and their family. It's available 24 hours a day, 7 days a week. They're always available. It provides for the care of the caregiver, it affirms life, and it neither hastens nor postpones death. Hospice was founded in England in 1961, thereabouts, formally founded. It came over here in the early 60s, and people liked it, but they didn't know what to do with it. But Medicare was coming along about that time. They were in their full force trying to decide what to do, how to save money, how to spend money. And in 1982, Congress approved the hospice as a Medicare benefit. In 1986, Congress made hospice benefits permanent, and in 1993, hospice benefits became a guaranteed benefit. So Medicare likes it a whole lot, and we're going to find out why in a few minutes. But how many people, what percentage of people, let's put it that way, what percentage of people in hospice have a cancer diagnosis? What would you guess? What would you think? Percentage of people in hospice care have cancer? Only 30. How many people, or what percentage of people in the United States would prefer to die in their homes? 80%. How many people, what percentage of people, are unaware that hospice care can be provided in their home? 75%. And how many people, percentage, do not know that Medicare fully covers hospice care at the rate of 100%? Now that's my favorite statistic. And these other statistics are things that you know. 85% of hospice patients are over 65. That's not hard to figure out. The over 65 age group is growing 3 times faster than the general population. We know that. This is the one that upsets me a lot. 2.4 million Americans die each year. Only 36% of them receive any kind of hospice care. And we're trying to change that because we're telling people like you everywhere we can what it really is. We talked about that it is a program of care in the home, but what does it provide? What does it include? It includes the services of a medical director, which is an MD, a nurse, case manager, who visits the patient generally twice a week, but it also includes the services of a home health aide who visits between 1 and 5 times a week, depending on the need of the patient. It has a social worker that is assigned to the family, and a social worker is very important because they take care of the family dynamics, make sure everything's moving along smoothly. They take care of being sure that the family gets all the services that they need. Maybe there are some other services out there in addition to hospice that could benefit the patient. They make sure that everything goes the way it should. So they're very important. And then there's a chaplain available to take care of the patient and the family's spiritual needs. So you've got a pretty important and talented team out there doing nothing but taking care of the hospice patient and their family. Hospice care is palliative care. Now, palliative care is a word that, in a discipline that's just sort of coming into its own. I understand that the medical schools are now giving courses in palliative care. Palliative care emphasizes the comfort of the patient. And this is comfort versus curative care. Curative care is when you're trying to make the illness go away, cure the disease. You're trying to get rid of whatever can, or make softer, for want of a better word, any condition that's afflicting the patient. But palliative care is the opposite. Palliative care is what kind of care you receive from hospice when you no longer want to do, or need to do, or can do curative care. A lot of people think that hospice is a place. Hospice is not a place. Hospice is a form of care. Most hospice programs in this country happen in the patient's home, but they can happen anywhere you live. They can happen in a nursing home, they can happen in a group home. Anywhere that you live, you can have hospice. For some reason, hospice facilities do better in the Northeast and just do terrible here in the South. And I guess people, I can't figure it out. I have several theories. One of them is, you know how Southern people won't ride public transportation. We like to have our own cars. Well, we like to be in our own homes. So I guess that kind of goes along with it. But every once in a while, someone here in the South will open a building and designate it a hospice, but they've never succeeded. So hospice is primarily in your home. Now, we talked about the interdisciplinary team. We talked about who's going to be helping you. You've got the medical director, the MD, we've got the nurse, we've got the home health aide, the social worker, and we have the chaplain, if you want to have one. Now, this is very important, and I want you to listen, and I want you to tell all your friends about this as soon as you get home. In addition to the services of the team, the hospice program provides all of the medicines needed to treat the hospice condition. Now, I know all of you have heard Plan D, cost of medicines. Don't worry about it. Medicare fully covers the drugs that hospice provides you with. Also, medical equipment. And medical equipment is just about anything. And this is, I had a question one time that said, how many pieces of medical equipment can we have in our home under hospice care that would be provided for Medicare? Technically, 20. But you know, you got a hospital bed and a wheelchair and a lift and anything that you need, like in the shower, you would have a shower. But anything that is needed to make that person more comfortable at home, up to and including beds and wheelchairs, is provided through hospice by Medicare at no charge. It is also supplies. Any kind of supply, any ointment, any topical creams, adult diapers, anything. It is brought to you by hospice and it is paid for by Medicare. Now, most people don't know that, but it's true. Who may use hospice? Who's eligible for hospice care? Hospice care is available to anyone with a life-limiting illness.
Would you repeat that, please?
Hospice care is available to anyone with a life-limiting illness. Life-limiting, that has a condition that they will not cure or survive.
Does there have to be a time element?
Absolutely not. And I'm glad you asked that question, because that is one of the things that has changed dramatically in the last few years. It used to be a person had to be certified by a doctor that they would die from their condition within 6 months. Well, Of course, a doctor doesn't want to say, well, you're sick and you're going to die in 6 months. It goes against the grain of just about everything that we believe and also doctors have been taught to do. So this has always been a problem. So this year, Medicare did something very radical. There's a nurse in this room, and I am going to explain this in detail in part for her because she didn't know about it, I don't think. Or if she did, she didn't have the details. This year, Medicare said, gee, after 25 years, we finally caught on that doctors don't want to say that you will not live further than 6 months. In the first place, they really can't do it. And in the second place, they don't want to do it. In the third place, we don't want them to do it. So what they developed were some guidelines for different illnesses. So instead of saying, all right, you have ALS, for example, I think you might die in 6 months. They can go to their guideline and say, all right, for a patient with ALS, when they have these conditions or symptoms, they are eligible for hospice care. There's no mention made of a time in there at all, and doesn't have to be. Heart disease, pretty much any type of heart disease is eligible if you meet certain guidelines. HIV at a certain point, liver disease if you meet certain, and it has to do with lab tests and benchmarks for those particular diseases. Pulmonary disease, we see a lot of COPD patients, and those are easily measured. Kidney disease, stroke or coma, Alzheimer's disease, and related disorders. Now, people have long been aware of Alzheimer's, but have not understood that Alzheimer's is a physical disease, and anyone that's dealt with it up close and personal comes to understand that. And people with Alzheimer's will progress to certain stages, and when they do, they're eligible for hospice care. Yes, sir. Please do.
Do you have to have a doctor's statement that you're eligible for hospice?
You're the perfect person in my audience today because you're asking absolutely all the right questions. No. Well, you do and you don't. Most people, if you wait for your doctor to admit you to hospice, you might wait forever because it's giving up. They don't like to do it, as we talked about a minute ago, but that's okay. That's all right, because you can admit yourself to hospice if you meet the criteria. A member of your family, if you meet the criteria, can be admitted. Anyone can be admitted to hospice if they meet the certain criteria.
What is it?
Okay. There's certain diagnoses are almost always hospice appropriate. Medicare has issued these guidelines, and I've been, as I said, working in hospice for many years. I've never known anyone, no, I won't say never, seldom have I run across anyone that thought that either they were hospice appropriate or their loved one was hospice appropriate that was not hospice appropriate. The best thing to do, any hospice, and I'm associated with Autumn Journey Hospice, so I'll just tell you what we do, but everyone's pretty much alike. What you do is you call this number or someone else if you have a referral to another hospice and ask for an evaluation. This is a free, there's no charge made for this. It's an evaluation where a member of the medical team and generally another member of the interdisciplinary team comes to your home at your convenience and evaluates the person in question. And this takes about an hour, but generally the team can tell you within 10 minutes if the person is appropriate to hospice. Now, you can say, okay, fine, I wish to be on hospice. I wish for my father, mother, husband, wife to be admitted to hospice. And hospice generally will call the physician and say, the personal physician of the person being admitted, and say, we have evaluated this person according to these criteria. They are appropriate for hospice admission. And 9 times out of 10, the doctor will say, that's great, thank you so much. And then we ask the doctor if he wants to manage this case or does he want us to manage this case. Very interesting. A lot of doctors at that point prefer for the hospice physician to be the case manager and treat that patient as their physician.
Does that take it away from the doctor?
Not at all. I mean, they can stay on the case if they like, and we have patients right now who we treat them for their hospice condition and we provide all their services, but if they have another condition, for example, non-terminal diabetes or something else, then they go to their own physician for that. So it just kind of depends on what the person wants to do and what the doctor wants to do.
I'd just like to give you an analogy and see if this is too
Sure.
far-fetched, but in 1999, I had a little skin cancer on my face, which was a basal carcinoma, but I had some spots on my leg, and so the dermatologist sent the spots on my face, which was a basal carcinoma, and the spots on my leg. And what surprised me was, I thought the spots on my face were the problem. He said, you have what we call mycosis fungoides. I never heard of that. I said, what is that? He said, that's a skin cancer. They said it's incurable, and if it ever gets into the lymph nodes, it's fatal. If it ever gets into the lymph nodes, we have no cure for mycosis fungoides. But if it ever gets in the lymph nodes, it's fatal. So far, it has not gotten in the lymph nodes since 1999. But it's an incurable cancer. How would I approach this with hospice?
Well, first thing you would do is get your diagnosis. If you did get the diagnosis, it had spread. Well, I would certainly ask for an evaluation. I'll talk to you after this and help you set that up. You can ask for an evaluation, and you might be close now due to other physical situations. I think you should have an evaluation now, because by hospice and a medical evaluation by hospice, and they're the ones that know better than anybody if you're appropriate. In fact, that's probably where it is the only place you'll get a really correct answer. And then once it's determined what your situation is, you can make decisions. Or if you're not appropriate, they will tell you at what point you will be appropriate, which is also an important thing. But I'll get with you right after I get through. All right, we talked about how does a person qualify for hospice. Now, this question I get frequently, and I used to give a really smart alecky answer. Somebody would say, well, what if you're on hospice longer than 6 months? And I would say, we put you out at the curb with the trash. What would you think we would do? And people were just so horrified with that, I stopped doing it, but I did it again. For the first 6 months, you're reevaluated. You're admitted to hospice, and in 90 days, we look at all of your conditions and see if you still qualify. You still have to meet the same criteria. Okay, then in 90 days, we have another evaluation. Now it's 6 months. What happens now? Do I go off? What happens? Nope. You're evaluated every 60 days till you either die or leave hospice. You're on it. If you became miraculously better, you would be dismissed and could come back on at any time. So it's very forgiving and it's very patient care oriented. Okay, I've got to talk real fast. Yes, Aldo.
What about those who are in an assisted living center already? Can you guys still jump in?
Absolutely, and we do that frequently. We're in a lot of assisted living situations.
So it doesn't interfere?
No. Occasionally, we have had a nursing home that has decided that they would make a lot more money if they had their own hospice that operated in their nursing home. So if that's the case, we can. But that's not all that common. We just have to look at each individual situation. we have people on hospice who have been under our care for one situation I'm thinking of is almost 3 years in this right now at this time, a person. What that means, it doesn't mean that they were not appropriate in their admission. What it means is they have not died, of course, but neither have they gotten better. They've pretty much stayed the same. They've held their own, but in every 60 days they're evaluated and they still meet the criteria. So there's really nothing to fear from hospice and everything to gain. Now,
sometimes hospice helps that.
what do you mean?
Well, like to have hospice there helps them feel better about themselves.
Oh, you're my second favorite audience participant. Okay,
I've worked in nursing homes and assisted living, and
there you have it.
difference.
I rest my case.
They're not there.
Well, this is what I believe, and over the years, we always felt and thought that hospice patients live longer than patients not on hospice with the same diagnosis. And we would have taken this to the bank or to the grave. We knew that this was it, but we couldn't prove it. Nobody could prove it. Well, this is an article from 3rd of January 2004. We found this. We ran across this, and it is an article that it published the results of a Medicare cost per patient for studied diseases. And they want to know if the patients on hospice cost them more or less than the patients not on hospice. Well, they've known for a long time that hospice patients, even with all of the care that they get from the interdisciplinary team, cost them a lot less than people who are going constantly in and out of the hospital and paying for all these services separately. So they published this study, and it says, hey, we were right, as we always knew. But down at the end of the study, there's this one little statistic, and it's median time until death in number of days. Alzheimer's, congestive heart failure, esophageal cancer, lung cancer, COPD, stroke. And just to make a long story short, and I'll show this to anyone that wants to see it after I'm through, hospice patients live much longer. The reason is they have constant care, like you said. Someone's looking at them, a home health aide, or a chaplain, or a social worker, or a nurse. Someone is always observing them. They know if this person is pale today, if this person just doesn't seem to feel as well today as they did the last time I saw them. So that being the case, they can just take action and get you back to feeling the way you ought to be feeling.
If you're admitted to hospice, did they drop you from prescription D or what?
No, that's a completely separate thing. Hospice, no, you keep that and you can use that for anything you want to. It's just out there. This is
Do you need prescription D?
You might, because hospice is paying for all of your admission diagnosis medicines, but you may have this other medicine out here that doesn't have anything to do with your hospice care.
Cover pain medicine?
Absolutely. And in all my years, I have never seen a hospice patient in uncontrollable pain. They are absolute masters and you know that, she's nodding, at keeping people out of pain and yet cognizant enough to enjoy their life. It's tough, it's tricky, but it can be done, and sometimes it's trial and error, but we don't give up on that. I'm so glad you came. Did you learn something? Did anyone in here learn anything today about hospice that they did not know before?
Yes.
Okay.
Can we get some of your literature?
I will give you everything you want. Okay, and I'll be here, and I'll step outside so the next speaker can come and answer any additional questions.